What are autoimmune disorders? Autoimmune disorders are described as any condition that affects the immune system. There are literally thousands of autoimmune disorders ranging from mild to crippling, depending on what area of the body is attacked and at what level. There isn't usually any easy cure, but with the right treatment the symptoms of autoimmune disorders can often be managed. Most commonly, autoimmune disorders are not serious, and a majority of sufferers can lead completely normal lives, provided their symptoms are treated and their disease is properly diagnosed. Here are some common autoimmune disorders. Anemia. Anemia is a result of too few red blood cells produced within the bone marrow. This leads to the body not producing adequate white blood cells. Autoimmune disorders cause the body's white blood cells to attack the healthy tissue cells and blood inside the body. This can result in swelling, pain, fever and fatigue. In extremely rare cases, autoimmune disorders may lead to anemia among infants and newborns. HIV/AIDS. HIV and AIDS are caused by the destruction of the immune system's ability to fight infection. This destruction occurs when the T cells, which destroy infection-causing organisms, are unable to function properly. HIV and autoimmune disorders both result in increased susceptibility to infection. Systemic lupus erythematosus. Another name for systemic lupus erythematosus is diffuse lupus erythematosus. This is a life-threatening disorder that causes inflammation of multiple organs, usually the skin, kidneys, heart and lungs. Anti-inflammatory drugs reduce inflammation, which enables the organs to heal themselves. This condition is extremely serious and should be treated promptly. Autoimmune reactions. There are many different types of autoimmune disorders, which include autoimmune disorders due to genetics as well as autoimmune disorders due to environmental factors. In autoimmune disorders due to genetics, the body's immune system attacks itself. This causes the cells to attack normal tissue. An example of an inherited autoimmune disorder is hypothyroidism. Environmental factors can cause the immune system to attack a specific tissue or organ. An example of an environmental factor causing an autoimmune disorder is living in an area where cigarette smoke is prevalent. Systemic lupus erythematosus. Systemic lupus erythematosus is considered to be autoimmune diseases characterized by inflammation of the skin, joints, gastrointestinal tract or other organs. Symptoms include extreme fatigue, arthritis, joint pain, ulcers and rashes. Diagnosis involves taking blood tests and performing blood tests to look for abnormalities in white blood cells or antibodies. Crohn's disease. This autoimmune disease is also called inflammatory bowel disease or irritable bowel disease. Symptoms include abdominal pain, diarrhea, weight loss and fever due to inflammation of the intestines and/or the large intestine. Researchers believe this disease to be due to abnormal function of certain intestinal cells. Antibodies may be released to fight the bacteria or fungi that are believed to be the cause of the inflammation. As of now, there is no evidence linking gluten to cancers. However, some studies have indicated there is a lower incidence of tumors in those who suffer from autoimmune diseases, such as celiac disease. There is, however, evidence linking the increased risk of colon cancer to those with gluten intolerance. It is unknown if the link between gluten and colon cancer is causal or predictive. Two of the autoimmune diseases that affect the body are autoimmune thyroid disease, also known as systemic lupus erythematosus, and lupus erythematosus. Systemic lupus erythematosus is characterized by widespread destruction of the immune system, usually affecting the lungs, skin, heart and kidneys. Lupus is characterized by skin rashes, fever, joint and muscle pain, fatigue, mouth sores and eye inflammation. Organ systems affected by systemic lupus erythematosus include the lungs, skin, eyes, heart, kidney, bones and brain. The symptoms of lupus are the same as those for systemic lupus erythematosus. However, in this disease, which is characterized by inflammation of the joints and muscles, open lesions, kidney stones and osteoporosis are not common. Researchers do not know exactly why some people are more susceptible to certain types of infections or conditions than other individuals are. Researchers have identified an exact cause of an autoimmune disorder. Some medical experts think that the malfunctioning of certain cells or tissues results to a defective or aged immune system. Researchers have discovered that genetic variations at the amino acid residue position 612 determine whether or not a person will respond to treatment with one particular type of medication. It was found out that people suffering from a thyroid disorder called Hashimoto's thyroiditis manifest hypersensitivity to the various kinds of immunosuppressants. Similarly, patients with autoimmune thyroid diseases are hypersensitive to the antibodies directed against the thyroid gland. This demonstrates that antibodies directed against the thyroid gland or the antibodies specific to various antigens can lead to autoimmune disorders. For more on how to treat some autoimmune disorders, see the link below for details.